how did you prepare for your application? Because if I recall, this was a second cycle, either for pedo ortho or it might have been the first cycle. So tell us, how did you go about preparing your application?
So I actually applied to residency 4 times. My initial application was for pedo, which I didn't match, and then I didn't post match as well. I did a GPR, and then I applied that year of my GPR into a ortho program, and then didn't match. The following year, I applied into a program, but then withdrew from the match. Then this year, I applied and matched. So that was, I'm a 4-timer.
I'm not confused, but I'm dizzy. But again, that's part of the process, right? That's what happens.
I can break it down a little further. I think, the initial time I applied for orthodontics, I did something that I think many other applicants shouldn't do, which is putting a lot of your eggs in one basket, which is essentially saying, like, this is a place I want to go. This is the residency I feel like I fit in best. And so maybe you may not have the funds or the resources, and so you focus all your attention on maybe 1 or 2 programs. And I think that confines you and puts you in a little bit of a box and doesn't allow other programs to see you and for you to see other programs. And I think I would say it was a little bit arrogant of me to even think that it was okay to try to apply to just 1 program or 2 programs and think that was going to become fruitful. Even if I ended up in the programs that I really wanted to go to and apply to, it's such a niche specialty and it's very competitive to the degree that I have to give it the respect that it's due. Like, I need to be able to spread, my eggs, right? And so that was the first time trying to get into ortho.
Hey, this is Dr. Darwin, your new dentist coach. Hey, look, it's residency time. It's residency application time. And the biggest question that a lot of people have is, how do I prepare my application? So look, if you're struggling in getting your information together, your CV, your personal statement, or you're ready but not prepared for your interviews, reach out to me ASAP, right? Through my group, Dental Residency Headquarters, we can help you. We can help you get ready for this residency cycle so that you're able to do this. We want you to match into residency cycle this year, all right? But you got some work to do. If you need some help with that application, shoot me an email at newdentistcoach@gmail.com. newdentistcoach@gmail.com. And through our program called Get Into Dental Residency, we can help you. But you got to hurry up, because residency application is right now. So shoot me an email right now. All right, let's get back to this episode.
Second, when I applied and withdrew, I recognized that, yes, you do need to do that, but you don't just go to any place. I think a lot of people do have a mentality that you should go where you're accepted because you're lucky to be accepted by any program. And while I do believe that it is a blessing to be accepted by any program, I don't want to be just anywhere. You understand what I'm saying? You're giving 2-3 years of your life, and chances are you're investing a massive amount of funds into acquiring and learning this specialty and acquiring a certificate and becoming board certified. It's a huge investment. The school you go to, in my opinion, it matters. The people that I think culture is something that a lot of orthodontic residencies are now coming to really pay attention to. Numbers are important to them, but now culture is also something that's taken into account. Like, how do you fit into this culture of individuals that you're going to learn with for the next 2 to 3 years? And also, what is this residency comprised of? And do you think that the way that you are as an individual matches up well with what you can receive from this residency? And so as I was applying, I won't mention the school, but I had applied to a particular program, and it seemed pretty clear cut that they would allow me to matriculate into their program in the following year. But I realized that this situation was not for me, and besides that, I wasn't in the position, whether it be financially or mentally, to jump back into school. at the time. And so I think timing and seasons is something that we really need to pay attention to, which is why I talked about patience.
Yeah, patience matters. Definitely matters, and having a plan and having a strategy as you are preparing your application, which includes programs, right? You have to know and do your due diligence with the programs. It's very, very important. So tell us, infuse in that a little bit more about the programs in the school and schools, and why you particularly were looking at the, those number of schools that you applied to.
So one thing that I found was a big divider was hospital-based and academic-based programs. Programs that were generated from hospitals. So, programs like Bronx Care and so on and so forth. But then you got academic programs coming from schools like Howard University, so on and so forth. And so I realized I did a GPR that was in a hospital-based program, and I think I gained a lot of valuable experience from there. And so that's an experience I'd already acquired. I recognize that when going back, I would prefer not to go back to a hospital-based program. That's just what I desire.
And that was just based on your experience. That was based on your current or previous experience.
Yes,
in being in that
I've already
environment.
had this experience in a hospital-based program. Had I never had one yet, then maybe that's something that I would consider. But because I've already had that, I recognize how precious and important education is. When you do choose to go somewhere, you're saying no to everything else. So I've already said yes to a hospital-based program. I've already done it. I've gained that experience. So I can say yes to a more academic-based program within a school system.
Right. School or institutional academic setting.
Exactly. Correct.
Not to say that hospital programs are not academic, right? But just that it's a little bit, it's a different setting, a little different than a dental school. Right?
It's a little different. Yeah. Like I think a lot of people going into even general, right? Some of them do GPRs versus AGDs. So, even that dichotomy, it matters. Like what type of experience do you want? And so you can't go to both. You got to choose one, right? And say no to the other. So
this cycle for applying to residency programs, and then specifically for ortho, how many programs did you apply to, and how did you come to that number of programs or schools?
So I started out with 10 and I trimmed it down to 8. The reason why I chose those schools, I looked for schools that had culture, like the culture of those programs. I think visiting programs is very important, but so that you can understand the culture of those programs. I think it's if you have the ability to travel around and see what programs are about, you should definitely do that. It does 2 things for you. One, it shows you if this is a place that you can be for the next 2 to 3 years. It also shows the program that you have a serious interest within it, because within what we're doing now, even if I'm working 5 days a week, sometimes 6, depending on who you are, you have to take off to make sure you go and visit a program. So programs understand the sacrifice that students and clinicians make to check their program out. So I think that's really important. And so
10 programs, narrowed it down
to 8, and got interviews to 2.
Your next assignment is go to the next video. Go to the next video right now. Go. Love, peace, and smiles. Go to the next video.